After age 60, 1 in 3 adults is already losing central vision, and the cell damage driving that loss begins years before a single symptom appears. The fruit sitting in your kitchen right now may be doing more for your retina than anything your doctor has mentioned. Here is what most seniors are never told. Those small moments when text looks slightly softer, when faces blur at a distance, when you need a little more light to read, your eyes are not just aging. They are signaling a process that, left unaddressed, quietly removes your ability to drive, to recognize your grandchildren's faces, to live without asking for help. And the question no one has answered for you yet, whether any of that decline can actually be slowed. I will answer that directly before this video ends. My name is Dr. Daniel. I am a clinical ophthalmologist who has spent over 20 years treating age-related vision loss and macular disease in adults over 60. In the next few minutes, I will walk you through 6 specific changes, starting tonight, that research suggests may meaningfully support your eye health from this point forward, because the window to act on your vision right now is not closed, but it is narrower than most people realize. Most people who eventually lose their central vision to macular degeneration do not see it coming, not because the warning signs were subtle, because the damage was already accumulating for years before a single symptom appeared, and everything that was quietly accelerating it felt completely normal at the time. A newspaper left on a windowsill in full sunlight does not look different on day 2 than it did on day 1. By month 3, the yellowing is undeniable, the fibers breaking down, the ink fading in ways that cannot be reversed. The macula, the small, dense central region of your retina that gives you the sharpness to read a face, a label, a road sign, degrades in exactly this way. Photoreceptor cells lost in increments so small you cannot perceive them. The exposure is daily. The damage is real. The awareness arrives late. After 60, the eye's own antioxidant defense system, the biological mechanism that neutralizes free radical damage to retinal tissue before it accumulates, becomes measurably less efficient, and without consistent dietary replenishment of the specific compounds that system depends on, oxidative stress builds in the macula and lens at an accelerating rate that no amount of good general health fully offsets. Your daily habits have been shaping your vision right now for years, often in ways you were never told to pay attention to. I have spent over 2 decades watching this progression arrive in patients who had done everything else right. The 5 threats I am about to name are not rare clinical scenarios. They are woven into the routines of most adults over 60, and several of them will almost certainly apply to you. The way screen light interacts with the aging eye is not the same conversation parents have about children and devices. This is something different, and it is more serious than most people realize. After 60, the crystalline lens, the clear structure inside your eye that focuses light onto the retina, gradually loses its capacity to absorb high-energy visible light, specifically the blue wavelengths emitted by phones, tablets, and televisions. Before 60, that lens acted as a meaningful filter. As it ages, that filtering capacity declines. The result is that more blue light reaches the retinal pigment epithelium, the layer of cells directly beneath your photoreceptors, per hour of evening screen exposure than it did 10 years ago, and you would have no way of knowing that shift had occurred. Blue light wavelengths at the retinal pigment epithelium generate reactive oxygen species, unstable molecules that damage cell membranes, disrupt repair mechanisms, and accelerate the very oxidative stress cycle already present in the aging macula. Research published in investigative ophthalmology journals documents this cumulative phototoxic stress in aged retinal pigment epithelial cells, and the pattern is consistent. The damage is not acute, it is additive. Studies indicate that prolonged evening screen exposure may contribute to oxidative stress at the retinal level, though individual risk depends significantly on existing macular health status, which is why consulting your eye care provider about your specific exposure pattern matters more than any general guideline. The next threat is one most seniors genuinely believe is not a threat at all, because they believe they are already managing it. Deep inside your retina, sitting in front of the macula, like a biological lens filter, is a thin layer of yellow pigment. That pigment is composed of two carotenoids, lutein and zeaxanthin, and it is the primary reason some eyes handle decades of oxidative exposure better than others. It absorbs blue light before it reaches the photoreceptors. It neutralizes free radicals at the point of greatest retinal vulnerability, and it is not produced by your body. Every molecule of lutein and zeaxanthin currently in your retina arrived through food. Macular pigment optical density, the clinical measurement of how concentrated this protective layer is in your retinal tissue, declines with age. It can be replenished through diet. The AREDS-2 clinical trial, conducted by the National Eye Institute, examined the role of specific carotenoid nutrition in AMD progression and produced findings that have shaped retinal nutrition guidance for years. Studies indicate that higher macular pigment density is associated with a meaningfully reduced risk of age-related macular degeneration, advancing to the stages that rob you of the ability to read, drive, and recognize the people you love most. Have you noticed any changes in your vision recently? Even small ones you have been telling yourself are just part of getting older? A slight softening of text? A moment where a face at a distance was harder to place than it used to be? A need for more light to read comfortably? How long have you been dismissing those moments? I read every comment on this channel. Share your experience below. You are not alone in this, and what you share here may matter to someone else watching. Research suggests that consistent dietary intake of lutein and zeaxanthin may support macular pigment density over time, though this does not replace medical evaluation of any existing retinal condition. The specific food that closes the question raised at the beginning of this video, the one sitting in your kitchen that most consistently delivers these compounds in a form the aging eye can actually absorb, is answered next. The answer is kiwi fruit. Not because it contains the highest absolute quantity of lutein and zeaxanthin among all plant foods, it does not. But because the matrix in which those carotenoids exist in kiwi fruit appears, based on nutritional ophthalmology research examining whole food bioavailability versus isolated supplement forms to support particularly efficient absorption and transport to retinal tissue. Carotenoids in supplement form must be processed and packaged by the body. In whole food form, and specifically in kiwi, the surrounding cellular structure may enhance the rate at which lutein and zeaxanthin actually reach the macular pigment layer where they are needed. There is more. Kiwi fruit contains one of the highest vitamin C concentrations of any commonly eaten fruit, and vitamin C is a primary antioxidant in the aqueous humor, the fluid filling the front chamber of your eye. Studies indicate that adequate vitamin C levels in ocular tissue may be associated with a reduced rate of cataract formation over time, the clouding of the crystalline lens that progressively dims your vision and, if unmanaged, takes your ability to function independently long before you expect it. Every day your macula goes without. These specific compounds is a day it manages oxidative exposure with fewer resources than it needs. That is not a reason for alarm. It is a reason to act, starting tonight. Studies indicate that regular kiwi consumption may support macular pigment levels over time. This reflects dietary pattern research and does not constitute a recommendation to replace any prescribed treatment for existing eye conditions. The next threat is the counterintuitive one, the one most likely to apply to viewers who believe their diet is already doing its job. Your vision right now may be paying a price for a habit you have considered a health choice for years. I still think about a patient I will call Gerald, 69 years old, who came into my clinic certain he needed a new glasses prescription. He described his diet as clean, low in fat, minimal processed food, consistent for over a decade. When his retinal imaging came back, the story it told did not match the story he had been telling himself. His omega-3 intake was near zero. He had spent years carefully removing fat from his diet and had unknowingly removed the one structural fatty acid his photoreceptor cell membranes depended on to function. The outer segments of the rods and cones in your retina, the actual photoreceptor structures that convert light into the signals your brain reads as vision, are among the most DHA-rich tissues in the human body. DHA, docosahexaenoic acid, is not optional for these cells. It is structural. It determines membrane fluidity, the physical property that allows photoreceptors to respond to light efficiently and to resist the oxidative damage they are exposed to every waking hour. When dietary omega-3 intake is chronically insufficient, that membrane fluidity decreases, and the cells that are responsible for your sharpest vision begin operating at a structural disadvantage. Research published in the American Journal of Clinical Nutrition and in retinal-specific omega-3 studies examining DHA concentration in macular tissue indicates that populations with higher omega-3 dietary patterns show reduced rates of AMD progression over time. The phototransduction cascade, the biological sequence through which light becomes a visual signal in your brain, depends in part on the structural integrity of the membrane in which it occurs. Research suggests DHA may also support anti-inflammatory pathways in retinal tissue, reducing the chronic low-level inflammation that contributes to macular degeneration progression. A patient I will call Carolyn, 70 years old, came to me after dismissing a central blur in one eye for 14 months. She was certain it was fatigue. She told me she had been taking a daily multivitamin for years and felt confident her nutritional bases were covered. By the time she sat in my examination chair, one eye already showed geographic atrophy, a late-stage, irreversible form of dry AMD, where entire regions of the retinal pigment epithelium have been lost permanently. The multivitamin she had trusted contained no meaningful omega-3 and no carotenoids at the doses that retinal research had examined. No one had told her. She had been doing what she believed was right, faithfully, for years. Research suggests that consistent dietary omega-3 intake may support retinal cell membrane health and may be associated with reduced AMD progression risk. And an eye care professional is best placed to assess where your intake currently stands relative to your individual retinal health. The fifth threat is not nutritional. Most of you will recognize it the moment it is named, and many of you will realize you have been living with a silent version of it for longer than you knew. Diabetic retinopathy is the leading cause of new blindness in adults globally. That fact alone carries weight. But the retinal vascular damage it represents does not begin at a diabetes diagnosis. It begins in the microcirculation, the finest capillaries supplying oxygen and nutrients to your retinal tissue, years before blood sugar reaches a threshold that triggers a clinical label. Blood sugar fluctuation in the high normal range, in people who have never been told they are diabetic or even pre-diabetic, is sufficient to initiate this process in genetically susceptible individuals. The retina is the most metabolically demanding tissue in the body relative to its size, and it is supplied by the most delicate capillary network in your entire vascular system. Chronic glucose fluctuation generates advanced glycation end products, compounds that stiffen capillary walls, impair the delivery of oxygen to retinal cells, and accelerate the oxidative burden the macula is already managing. Long-term WHO epidemiological data on diabetic eye disease in adults over 60, alongside decades of research from the Diabetes Control and Complications Trial, establish this retinal vascular vulnerability as one of the most consequential and least discussed threats to senior vision. Studies indicate that blood sugar management is strongly associated with retinal vascular health, and adults over 60 who have not had a fasting glucose assessment within the past 12 months should discuss this with their physician, particularly if any small changes in vision have been present. After everything I have just walked you through, the question I hear most often in my clinic is a simple one, and it is worth addressing directly before we go any further. The belief that vision loss after 60 is simply genetic destiny, that the decline is pre-programmed, that whatever was going to happen is already written in your cells, and that nothing you do from this point forward changes the trajectory, is the most expensive assumption in senior eye health. It is understandable. It is also incomplete in ways that matter enormously. Genetics establishes a floor. It sets your macula's baseline structural vulnerability, the starting efficiency of your antioxidant defense systems, your photoreceptors' baseline resilience. What genetics does not determine is the speed at which that vulnerability converts to functional vision loss. That speed is heavily modulated by daily nutritional inputs, oxidative exposures, and vascular health, all of which are within your influence. Research on AMD progression is consistent on this point. Two individuals with identical genetic risk profiles can arrive at age 80 with dramatically different functional vision based entirely on what their eyes were given and protected over the preceding 2 decades. I have watched this play out in clinical practice across more than 20 years. The patients who maintained the best visual outcomes were rarely the ones with the most favorable genetics. They were the ones who received specific information early enough to act on it. Your vision right now is not fixed. The rate of change is something you have more influence over than most people are ever told. 3 specific things you can do about that begin tonight. What you now know about your retinal health, the mechanisms, the threats, the specific compounds your macula depends on, most adults your age will never know. That knowledge is only useful if it moves. First, tomorrow morning, add 1 lutein-rich food to your breakfast. Eggs, cooked kale, or spinach. All 3 are effective sources. Because lutein is fat-soluble, it absorbs significantly more efficiently when consumed alongside a small amount of dietary fat, which makes a single egg one of the most practical delivery vehicles available. 1 egg or 1 handful of cooked greens is a genuine and meaningful addition to your macula's daily nutritional input. Second, tonight, reduce your screen exposure in the hour before you sleep. Not permanently, not dramatically, just the final hour. This is the period when your eye's melatonin-linked repair processes are initiating, and it is the same period during which cumulative blue light continues generating reactive oxygen species in the retinal pigment epithelium. Reducing that final hour of exposure costs nothing and directly addresses the mechanism outlined earlier in this video. Third, if it has been more than 12 months since your last comprehensive eye examination, Schedule 1. The silent damage window we discussed in the foundation of this video is real. Significant macular change can accumulate within a 12-month interval without producing a single symptom you would notice. An examination closes the gap between what may be happening in your retina and what you currently know about it. And here is the honest answer to the question that has been open since the beginning of this video: whether what is already happening in your eyes can be meaningfully slowed. Research suggests that consistent antioxidant nutrition, specifically the lutein, zeaxanthin, omega-3, and vitamin C profile we have covered today, may support a meaningful reduction in the rate of age-related retinal decline when maintained over time. It does not undo damage already done, but your vision right now is the baseline from which protection either begins or does not. And that moment is tonight. Before you close this video, let me bring together everything your eyes need you to carry forward. Cumulative blue light exposure accelerates retinal oxidative stress after 60 through a mechanism that is invisible and dose-dependent, and it intensifies precisely because the aging lens no longer filters it the way it once did. Lutein and zeaxanthin, the 2 carotenoids forming your macular pigment layer, decline with age and cannot be produced by your body, which means every day without adequate dietary intake is a day that filter weakens. Kiwi fruit, consumed regularly and ideally before bed, delivers a bioavailable carotenoid and vitamin C profile that research suggests may support retinal pigment density in ways that matter to your long-term vision. Omega-3 deficiency, invisible in diets that appear otherwise healthy, compromises the structural integrity of the photoreceptor cell membranes responsible for your sharpest central vision. And blood sugar fluctuation, even in the range that never triggers a clinical diagnosis, initiates retinal microvascular damage years before any symptom arrives. In the comments below, I want to know, what is the one small vision change you have been quietly dismissing? The thing you have been telling yourself is just aging, just fatigue, just needing a stronger prescription. And now that you have watched this, what are you going to do differently? Be specific. Your answer may matter to someone else reading this thread. If someone in your life has mentioned eye strain recently, or noticed their vision feeling softer than it used to and waved it off, send this video to them directly. not as a general share. As the specific thing you wish had reached you sooner. In the next video on this channel, I am going to walk you through the 3 specific clinical eye tests that can detect early macular degeneration before a single visual symptom appears, and why most standard annual examinations do not routinely include them. That video may be the most important one I publish this year. Vision is the sense we assume will be there until the day it quietly begins not to be. The fact that you watched this video today and chose to understand what is happening inside your eyes rather than wait for a symptom to force the conversation is not a small thing. Act on one piece of what you learned here tonight. That is enough to start.